You're either here because you're about to start school and you want a head start on how to speak the dental language, or you're a patient who just wants to understand what the heck the dentist is saying about your teeth. Either way, let's talk. My name is Whitney and I'm a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. I know sometimes it can be super confusing to understand what the dentist or the dental hygienist is saying about your teeth. Sometimes I catch myself talking all science-y to the patient, things like, "There's clinical decay on the distal of 14 and slight radiolucency on the interproximal surface." Like, what? The reason for this is because I think it's easier for us dental people to communicate specifically exactly what we see. The scientific terminology is more descriptive instead of trying to explain things like, "Yeah, I see something kind of weird in between those two back teeth. It's kind of darkish." Do we sometimes talk like that if we can't find the proper terminology quick enough? Sure, but oftentimes we do talk more scientific and specific. So I'm going to give you some tips and tricks on how to decipher this dental terminology. Let's start with the upper teeth are your maxillary teeth, and the lower teeth are your mandibular teeth. Next is anterior versus posterior. Anterior is your front teeth from canine to canine. These canines can also be called cuspids, or the eye tooth, or I've even heard the vampire tooth. And the word posterior refers to all of the back teeth behind the canines. Now, breaking it down even further, the front teeth, or the anterior teeth, are the same on the top and the bottom. And the four middle ones, the four in the middle, are called incisors. And specifically, the middle two incisors are the central incisors, and the outer two are the lateral incisors. These laterals are located between the central incisors and the canines. I hope that made sense. The anterior ones are the hardest ones. It only gets easier. There's only two more types of teeth left. Our back teeth, or like I said, the posteriors, are composed of two types of teeth: the premolars and the molars. The first two, going back from the canines, are the premolars, the first and the second. So you will have first premolar and second premolar. These premolars can also sometimes be called the bicuspids. Why does everything have to have two names, right? And the back two or three are called the molars. You have the first molar, the second molar, and the third molar. And your third molar can also be called your wisdom tooth. Cool, so that's all the teeth in your mouth. Another thing we use to describe them is calling them by their tooth numbers. Now, I believe orthodontic offices, some of them in the US, use a different numbering system from general dental offices, and other countries may use different numbering systems as well. So I'll just be going over the numbering system that I use and that is most commonly used in the US. So what you do is you start counting on your upper right teeth. And including your wisdom tooth that may or may not be present, you just start counting at 1. So it goes 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. And that was the top from right to left. Now we go down to the lower left and we start counting the bottom from left to right. Number 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32. Keep in mind that lots of people will be missing their wisdom teeth, also called their third molars. So numbers 1, 16, 17, and 32 are often missing, but you still have to count them when you're counting. Pro tip, a trick I used when memorizing the tooth numbers was starting by memorizing the canines are 6, 11, 22, and 27. And then it just helped me visualize everything else from there. You can just throw me a number and I'll tell you what tooth it is because I just visualize 6, 11, 22, 27, and then I just know them all. So like number 13, upper left second premolar. After working on teeth for years, obviously it becomes easier, but that's a great way to test yourself. Okay, we're almost there. The last thing we need to go over is how to describe the surfaces of each tooth. So if there is a cavity, also known as decay or dental caries, we don't just say there's a cavity on the backside of the tooth. We have a word to describe the backside of a tooth. So last thing, we're gonna go over these words that describe each tooth surface. The surfaces that are in between the teeth are called the interproximal surfaces or IPR. So for example, let's look at a molar. The interproximal side that is closest to the midline of your face is called the mesial, and the interproximal side that faces toward the back back of your head or away from the midline is called the distal. That works for every single tooth in the entire mouth. Just note when you get to the middle where the midline is. The midline is between the two front teeth, on the top and on the bottom. So these surfaces on number 8 and 9, for example, are both the mesial surfaces. And these are both the distals. Of course, it's hard when I can't pull the teeth out to show you, but you get the idea. If I were to pull this tooth out, this surface right here is the distal. So we understand in between the teeth. Got it. Done. Next are the surfaces on the insides of your teeth. These are the surfaces that you can touch easily with your tongue. On the top, it's the surface next to the roof of your mouth, and on the bottom, it's the surfaces next to the tongue. So those inside surfaces that you can touch with your tongue are called the lingual surfaces. When you're coding and putting it into a computer, you're most likely always going to put lingual, but just so you know, on the top, where your palate is for the top teeth, those lingual surfaces can also be called palatal surfaces. Now the outsides. The surfaces towards your lips and your cheeks are called the facial surfaces. No matter if they are posteriors or anteriors, we call the beautiful part you see when you smile, we call these the facials. However, if we want to get even more specific, we can call your anterior facials the labials. But honestly, not too many dental professionals use this word anymore. The posterior facials can also be called the buccal surfaces. Buccal is a descriptive word that we often do use. So again, facials are all of them, but the labial for the anteriors and the buccal for the posteriors are the more specific terms underneath the umbrella term facial. The final surface description word that we'll go over is the chewing surface. The chewing surface is called the occlusal for the posteriors, where you bite and it's groovy, and lots of people are more prone to getting a cavity in, right? And for the anteriors, since there's no actual groove on the chewing and biting surface of these anterior front teeth, we call it the incisal. Because again, the anterior biting surface is super thin compared to the chewing surfaces of the posteriors. I know that may have sounded like a lot, but if you go over it a few times, it will get easier to understand this terminology and figure out all the details. And before we go, going back to that example that I used at the beginning of this video, I said something like there's clinical decay on the distal of 14 and a slight radiolucency on the interproximal. So we now know that decay is a cavity, and clinical means I can see it clinically on the distal surface of tooth number 14. So the first part was easy. We got it. But the part where I said there was a slight radiolucency on the interproximal surface, we know interproximal means in between the teeth, but the radiolucency, I would have been referring to an x-ray. That part was a trick for y'all. Because if we're talking x-rays, that's a whole nother video with a whole nother set of jargon. But really quick, radiolucent can mean dark, and dark can mean decay. But darkness can also be super normal on other areas of the tooth, like specific areas like the nerve is dark. Radiopaque means light or white, which can also be a bunch of things. Tori, or even the teeth themselves. So like I said, that's a whole nother topic for a whole nother video, but for the purpose of this video, we talked about what we can see clinically, and hopefully it will help you decipher what is what in your mouth. If you are interested in a video about deciphering x-ray terminology, I'd be happy to make that. Let me know in the comments below. I just don't want to make it if you think it's boring. Thank you again for watching. I hope this video helped you. Please like and subscribe if it did, and if you want more teeth talk, you can visit my website, teethtalkgirl.com, for more dental health articles and videos. And until next time, peace, love, and teeth.